I'm Kristine Batty, a nurse practitioner, board certified in advanced diabetes management, and a certified diabetes care and education specialist. I am also a person living with type 1 diabetes for over 40 years. My perspective allows me to bridge the gap between clinical expertise and real-world experience. As a provider, I understand the science behind diabetes management, but as someone who wears the tech, I know the daily challenges firsthand. Join me as we explore cutting-edge technologies and practical tips that will better help you assist your patients living with diabetes. Continuous glucose monitoring is one of the most exciting innovations in the history of diabetes treatment. CGMs reveal what the blood glucose patterns are in real time in an ongoing fashion. Before the CGM, this important information was unknown, making achieving glucose targets difficult. It can be surprising to people wearing a CGM for the first time to see glucose values they did not know existed. This was definitely the case for me when I began using a CGM, as well as for many people that I have provided care for. My fasting blood glucose was always at target. Then I ate my usual breakfast, a bagel. I was stunned to see my blood glucose rise well above 300. I thought to myself, that cannot be right. I immediately thought that the CGM was incorrect, defective, or just not working. I considered taking off the CGM and not using it anymore. Then I began to worry about the effect of this hyperglycemia. I started taking extra insulin, sometimes a few times in a few hours, to get that number down. As a provider, I have seen this same scenario occur numerous times when a person starts wearing a CGM. In those first several days of wearing a CGM, the biggest lesson I learned about my CGM patterns was that these glucose values were always there. I was just seeing them for the first time now. I needed to keep in mind the experience of shock that I had when I first started using a CGM. Let's take a look at the experience of wearing a CGM from the other side of the exam table. You have a patient with an A1C of 8.9%. Their target A1C is less than 7%. You, along with the person with diabetes, decide that using a CGM will be a great tool in the treatment of their diabetes. As a healthcare provider, you need to discuss expectations. The first expectation is that there are going to be glucose values that will be surprising. For example, if the A1C is elevated, there will be hyperglycemic values. This is what you're looking for. Discuss the possibility that a bagel is more reactive to their blood glucose than, say, oatmeal. This does not mean that they can't eat the bagel, but maybe the treatment therapy needs to be altered to accommodate that particular food. There should be no judgment passed about these values. As a medical provider, you need to be aware that the person with diabetes may have fear about those new glucose values. They've never seen a number like this before and think something bad is going to happen to me. When they see these numbers, their knee-jerk reaction might be to take more medication. This may be unsafe because people might over-medicate, and unfortunately, this may drop their blood sugar severely low. Others will take extra pills, which is very dangerous because they may exceed the maximum dose. Be sure to review medication action curves. Discuss watching the glucose trend for the duration of the medication action before acting upon it. All people with diabetes that are using diabetes technology need to be working with a certified diabetes care and education specialist for education and support. This will increase the success in achieving glycemic targets and comfort in using their devices. 3 takeaways. Number 1, discuss expectations about glucose trends. There are values that were unknown before and now are being seen. This is why the CGM is being used. Number 2, review medication action and how to safely treat unexpected glucose values. Number 3, be sure to use the data to adjust treatment therapy, which includes lifestyle and medication. For more on this topic and other diabetes technology topics, please visit danatech.org from ADCES.